بسم الله الرحمن الرحيم. السلام عليكم أعزائي الطلبة. Our subject today about sinusitis. This is a coronal section of the nose and paranasal sinuses. It shows the maxillary sinus, the ethmoid, and the frontal sinuses. And this is the nasal septum. This is the inferior turbinate and the inferior meatus, the middle turbinate and the middle meatus. We have an area within the middle meatus called osteomeatal complex. It is a functional anatomical area within the middle meatus. It consists of the hiatus semilunaris, the uncinate process, the ethmoidal infundibulum, and the ostium of the maxillary sinus, and the bulla ethmoidalis, which contains the anterior ethmoidal air cells. There is a thin bone separating the orbit from the ethmoidal air cells. This is called lamina papyracea. This is the lateral wall of the nasal cavity, and we see the inferior turbinate and the inferior meatus, the middle turbinate and the middle meatus. Here, the area which is called osteomeatal complex. It consists of the uncinate process, the hiatus semilunaris, and the bulla ethmoidalis, and this is the opening of the maxillary sinus, the ostium of the maxillary sinus. And here we see a probe passing from the hiatus semilunaris through the frontonasal duct into the frontal sinus. Here the superior turbinate and the superior turbinate and the superior meatus. The posterior ethmoidal air cells opens into the superior meatus, and this is the opening of the sphenoid sinus. The sphenoid sinus opens into the sphenoethmoidal recess, and this is the pituitary fossa, and this is the Eustachian, opening of the Eustachian tube. Another picture shows the air cells, the anterior ethmoidal air cells within the bulla ethmoidalis. This is the ostium of the maxillary sinus. What are the functions of paranasal sinus? The primary function of the paranasal sinuses is unknown, but there are many theories about this function, including the humidification and warming of the inspired air, regulation of intranasal pressure, increasing the surface area for olfaction, lightening the skull weight, resonance of the voice, absorbing the shock. The paranasal sinuses can act as an air cushion to protect the eyeball and the brain from the external trauma, and they contribute to the facial growth. The development of the sinuses, the maxillary and ethmoid sinuses, they are present in a clinically significant size at birth, and they are fully developed at the age of 12 years, while the frontal sinus is present in a clinically significant size at the age of 3 years, and it is fully developed at the age between 18 and 20 years, while the sphenoid sinus is present in a clinically significant size at the age of 8 years, and it is fully developed at the age between 12 and 15 years. Sinusitis is an inflammation of the sinus mucosa. It is a common condition, and it is now regarded as a continuation of the spectrum of rhinitis. Mr. Klinger, he is an Austrian rhinologist. He is the pioneer of endoscopic sinus surgery. He is described the osteomeatal complex which is very important in the pathogenesis of sinusitis. He found that any obstruction, whether by anatomical abnormalities or mucosal abnormalities at this area, can cause impaired the drainage and outflow obstruction of the frontal, ethmoid, and maxillary sinuses. The most common sinuses are affected by sinusitis, the number 1, maxillary, followed by the ethmoid, then the frontal, and less commonly the sphenoid sinus. To understand the pathogenesis of acute sinusitis, any inflammation within the nasal cavity, rhinitis by upper respiratory tract infection, causes obstruction of the sinus ostium. The diameter of the ostium about 1 to 3 millimeters. It is easily closed and obstructed by edema of the mucosa. So, inflammation and obstruction of the sinus ostium leading to a mucus build up within the sinus. Stagnant mucus contributes to bacterial overgrowth and infection and further swelling within the sinus. Acute sinusitis, it is thought that everyone will suffer from an episode of sinusitis in their life. It is caused by an acute bacterial infection, which often develops after a preceding viral illness such as a cold. The most common bacterial pathogens in acute sinusitis are streptococcal pneumoniae and streptococcal pyogenes, Haemophilus influenzae, Moraxilla catarrhalis, and Staphylococcal aureus. The clinical features of acute sinusitis: usually there is a preceding upper respiratory tract infection, nasal obstruction, purulent rhinorrhea, severe facial pain over the affected sinus, pain which is worse on bending down or coughing. In acute maxillary sinusitis, usually the pain or pressure over the maxillary area or the cheek, toothache or headache. Acute frontal sinusitis presented with frontal headache. And ethmoidal sinusitis can cause pain or pressure between or behind the eyes, the side of the upper part of the nose, the medial canthi, and headache, while acute sphenoidal sinusitis can cause pain or pressure behind the eyes, retroorbital pain, and the pain radiating to the skull vertex, radiating to the mastoid processes and the occipital headache. A swelling on the face is usually caused by a dental abscess rather than by the sinus disease. Tenderness over the sinuses is an overemphasizing sign. It is a unreliable sign because of the exaggeration from the patient. The investigations of acute sinusitis: an anterior rhinoscopy to examine the inside of the nose, a rigid or flexible nasoendoscopy often shows pus in the middle meatus or edematous mucosa. These are signs of acute sinusitis: presence of pus within the middle meatus or edematous mucosa. This is the endoscopical view. Normal endoscopical view of the left nasal cavity shows a pinkish normal mucosa. This is the septum, nasal septum. This is the lateral wall of the nose, and this is the middle turbinate, and this is the middle meatus. This is an endoscopical view of the right nasal cavity. Shows red edematous mucosa and pus filling the middle meatus. Treatment of acute sinusitis by antibiotics. We use augmentin 625 milligram orally 3 times daily for 10 days with the use of nasal decongestant like xylometazoline 0.5% nasal drops. We give the patient 2 drops 3 times daily for 5 days with the use of anti-inflammatory betamethasone nasal drops 2 drops twice daily and the analgesia to relieve the pain. Usually the acute sinusitis controlled by medical treatment. If sinus symptoms don't resolve, consider sinus washout or endoscopic sinus surgery after CT scan of the paranasal sinuses to confirm the diagnosis. Good luck.